Let me ask you something you've probably never said out loud to anyone. If you're a man past 50, 60, or even 70, and you still masturbate, have you ever quietly wondered if it's actually safe at your age? Have you lain awake at night thinking, am I doing damage to myself? Am I hurting my prostate? Am I making things worse down there without even realizing it? If any of that sounds familiar, take a breath, because you are far from the only one asking. This is one of the questions I hear most often from men later in life. Yet it's almost never spoken about out loud. And here's the problem. There's so much conflicting noise around this topic. Some voices call it dangerous. Others insist it's absolutely necessary for good health. And in the middle of all that noise, most men are left with no real answers at all. So today, we're going to cut through the confusion and finally have this conversation properly. My name is Dr. Jocelyn. I've spent more than 10 years working as a urologist, and in that time, I've guided thousands of men through issues that go far beyond just the physical, their confidence, their sense of dignity, and their overall quality of life. In this video, we're going to talk about something most men never get the chance to discuss honestly, even though they deserve to. I'll walk you through 10 benefits of masturbation that might genuinely surprise you as an older man. Then, just as importantly, I'll cover 10 risks and mistakes you need to watch out for, so that this stays something that helps you rather than harms you. One of those risks especially might catch you off guard. But once you understand it, you'll be able to protect not only your prostate, but your long-term strength and vitality as well. Before we get into it, I want to ask a small favor. Tap that like button. It helps YouTube know this conversation matters and needs to reach more men. And leave a quick comment telling me where in the world you're watching from. I always love seeing how many different places our community comes from. Also, make sure you're subscribed so you never miss one of these honest health conversations. All right, let's begin with some good news. Here's the truth, plain and simple. Masturbation does not automatically wreck your body. It does not automatically weaken your performance. And it does not shorten how long you live. In fact, for a lot of men, when it's approached with awareness and balance, it can actually be a healthy part of everyday life. The real question was never whether you do it. It's how you do it, how often, and whether it's genuinely supporting your health or slowly working against it without you noticing. That distinction is something most men never stop to consider, and that's exactly why understanding both sides, the good and the risky, matters so much. So let's look at the actual science behind this. This isn't about old wives' tales, locker room jokes, or outdated shame. This is about what real research in fields like urology, hormone science, and psychology has taught us about how the male body changes with age. We're talking about findings from Harvard studies on prostate health, European research into hormone balance, and clinical observations of men well into their 60s, 70s, and beyond. And the evidence points to one clear conclusion. Masturbation carries real benefits, but it also comes with real pitfalls. Once you understand both sides clearly, you can use it as something that protects your health, instead of something that quietly chips away at it. So let's break it down, one piece at a time. Let's start with benefit number 1, and that's penile health. Think of an erection the same way you'd think about exercise for a muscle. When it happens, blood rushes into the spongy chambers inside the penis, known as the corpora cavernosa. That blood carries oxygen and nutrients along with it, and this is what keeps the tissue flexible and healthy over time. Without regular erections, that tissue can begin to stiffen. And once that happens, achieving firmness naturally becomes harder. So in a very real sense, masturbation works like a workout for this part of your body. Benefit number 2 is prostate health, and this one is significant. Several studies, including a well-known one from Harvard, have shown that regular ejaculation helps flush out the prostate gland. That means the secretions, dead cells, and toxins that build up inside don't just sit there. And when they don't accumulate, your risk of both prostate enlargement and even prostate cancer goes down. Benefit number 3 is a stronger pelvic floor. Every time you reach orgasm, it triggers rhythmic contractions in your pelvic muscles, particularly one called the pubococcygeus. When those muscles stay strong, it means better control during erections, better control over your bladder, and a lower chance of dealing with leakage or incontinence as you get older. Benefit number 4 is lower cortisol, which is your body's main stress hormone. We're all living in a high-stress world these days, and masturbation causes a real, measurable drop in cortisol levels, the same hormone responsible for raising blood pressure, fueling anxiety, and putting strain on your heart. In other words, this is one of the body's own built-in tools for relieving stress. Benefit number 5 is a release of feel-good brain chemicals. Dopamine, oxytocin, endorphins, all of these surge through your system right after orgasm. That's exactly why so many men describe feeling calm, connected, or even genuinely happy afterward. And for older men in particular, this kind of chemical boost can be a real weapon against loneliness, low mood, and lack of motivation. Benefit number 6 is improved self-awareness, which can actually lead to early detection of problems. When you regularly touch and pay attention to your own body, you naturally learn what feels normal for you and what doesn't. Many men first notice things like a lump in the testicle, a condition called Peyronie's disease, or unusual swelling, simply during private moments like this. And catching something early can genuinely save your life. Benefit number 7 is better sleep. After orgasm, your body releases hormones like prolactin and oxytocin, and both of these have a calming effect that helps you fall into a deeper, more restful sleep. For men who struggle with insomnia, this can turn out to be a surprisingly effective tool. Benefit number 8 is improved blood circulation in the pelvic area. It's not just about erections here. That increased blood flow also benefits your prostate, your bladder, and the muscles surrounding them. Poor circulation can lead to stagnation, and that stagnation tends to make urinary symptoms worse over time. This habit helps keep everything moving the way it should. Benefit number 9 is better control over ejaculation. Using conscious techniques, like what's known as the stop-start method, gives you a private, low-pressure way to practice control over time. For men who deal with premature ejaculation, this kind of practice can translate into real confidence when they're with a partner. And benefit number 10 is that it keeps desire, and the neural pathways behind it, active and alive. Your brain is really the true center of your sexuality. By engaging in fantasy and stimulation, you keep the neural circuits tied to desire firing and functioning. This protects your libido over time, and it helps prevent what's often described as the use it or lose it effect that so many men experience as they age. So that covers the good news. But like any tool, everything comes down to how you actually use it. Now let's move into the 10 risks you need to be aware of. Risk number 1 is social isolation. When masturbation starts replacing real human connection instead of existing alongside it, that's when men risk pulling away from relationships altogether. Remember, pleasure is at its healthiest when it adds something to your life, not when it becomes a wall that shuts you off from everyone else. Risk number 2 is small tears in the skin, sometimes called microlesions. Too much friction, or not using any lubrication, can cause tiny tears in the skin of the penis. These small injuries can lead to irritation, inflammation, or even open the door to infection. The fix here is simple. Be gentle with yourself and use a good water-based lubricant. Risk number 3 is desensitization. If you always use the exact same pressure or grip, your brain slowly gets conditioned to only respond to that one specific sensation. Over time, this can make arousal with a partner more difficult to achieve. The solution is to vary your technique from time to time. Risk number 4 is masking erectile dysfunction. Some men find they can only get firm during masturbation, but not when they're with a partner. That is not just a normal part of aging. It's often an early warning sign of something like heart disease, diabetes, or low testosterone. If this sounds like you, it's worth bringing up with your doctor. Risk number 5 is nerve compression caused by poor posture. Sitting hunched over in a chair for long stretches can put pressure on the pudendal nerve, which can lead to numbness or pain. Try lying back comfortably instead, or simply switching positions during longer sessions. Risk number 6 is using it as an emotional escape. If masturbation becomes your only way of coping with stress, loneliness, or boredom, it can turn into a crutch rather than a healthy habit. It's important to build other coping tools alongside it, things like exercise, spending time with friends, or meditation. Risk number 7 is guilt and shame. A lot of older men grew up carrying messages that this was something dirty or wrong. That kind of guilt can quietly eat away at your confidence and your sense of joy. If that resonates with you, it may help to speak with a sex-positive therapist who can help you reframe it as the natural, healthy act it actually is. Risk number 8 is pelvic congestion. It's true that too little ejaculation can be tough on the prostate, but the opposite is also true. Doing it multiple times a day over long stretches can lead to aching, heaviness, or even fatigue. The answer here is simply to listen to your body. Moderation is the key. Risk number 9 is reduced semen quality. Now, most older men aren't actively trying to have children, but if you are, daily ejaculation can lower your sperm concentration. For fertility purposes, the ideal window tends to be somewhere between every 2 to 5 days. And risk number 10 is losing touch with reality through pornography. When the brain becomes overstimulated by extreme content online, it can distort what you come to expect from intimacy. Real closeness with another person can start to feel less satisfying by comparison. If you do use pornography, it helps to balance it with imagination, memory, and genuine connection with a real partner. So, what's the real takeaway from all of this? It's actually simple. Masturbation after 60 isn't something that's inherently good or inherently bad. It's a tool. When it's used with awareness, moderation, and a bit of variety, it can support your prostate, protect your ability to have erections, lower your stress levels, and even help you sleep better. But when it turns into something compulsive, isolating, or physically careless, it can start working against you instead. So here's what I'd recommend as a healthy baseline to work from. Aim for moderation. Somewhere around 2 to 4 times a week is a reasonable range for most men. Use lubrication. And don't be afraid to vary your technique. Pay close attention to what your body is telling you. Aches, numbness, or any changes in arousal are signals worth listening to, not something to brush aside. And above everything else, remember that this is meant to enhance your life, not replace it. I understand this can feel like a deeply personal, even vulnerable topic to talk about. Many men have gone their entire lives without ever having an honest, shame-free conversation about it. But let me reassure you, there is nothing wrong with taking care of your body in this way. In fact, when it's done consciously, it can be one of the simplest and most private forms of self-care available to you. You don't need to carry guilt about this. You don't need to feel like you're too old for it. And you certainly don't need to go through it in silence. So if there's just one thing you take away from today, let it be this. At any age, whether you're in your 60s, 70s, or beyond, you are not past your prime. You are not broken. Your body still has the ability to feel pleasure, strength, and vitality. And when you treat that part of yourself with respect, it will keep serving you well for years to come. Small, conscious changes and a bit of awareness can bring back a sense of freedom, dignity, and confidence you may have thought was gone for good. If this video helped you in any way, give it a like, subscribe for more honest, science-based health conversations, and share it with a friend who might need to hear this but is too shy to bring it up himself. And now I genuinely love to hear from you. What was the one thing that surprised you most today? Drop it in the comments. I read every single one. I'm Dr. Jocelyn, and I want to remind you that your age does not define your vitality. Small, conscious habits can protect not just your prostate, but your overall quality of life. Stay strong, stay hopeful, and I'll see you in the next video.